Mr. Buckeye, after looking at your case in depth, I suspect that you have Crohn disease, given that you had a sibling with the disease, as well as your presenting symptoms. Crohn disease is an inflammatory disorder that can infect any part of the path that your food takes, or your GI tract. We are not sure what causes this disease, but there are some gene mutations linked to it that can cause increases in inflammation, which could be affecting you given your family history. This inflammation causes injury to the lining of the GI tract in what are called skip lesions because the inflamed area alternates with the uninflamed area. So I have a picture to show this. So right over here. These blue patches are the areas that would be inflamed. Just an example. So I do want to show you normal physiology and abnormal. So right here I have these pictures. So right here on this side are Crohn's affected intestinal lining cells, and over here are normal. So you can see these nice projections. These help our body to absorb nutrients. But what happens in Crohn's disease is that inflammatory cells get in at the base of these projections and cause destruction, infection, inflammation, sometimes even abscesses to occur. Also occurring sometimes even in fissures, which can ruin the intestinal wall integrity. So they call this the cobbling or cobblestone effect because all the cells are destroyed. It just looks very bumpy. So since you said there was blood in your stool a few times, we are going to go ahead and do a colonoscopy to view the inside of your colon. However, since Crohn disease can infect the entire GI tract, we may also want to do a capsule endoscopy where you basically swallow a mini camera and it takes pictures and transmits them to us until it comes out in your stool. Or we could do a small bowel series, which will have you drink some material that will cause your small bowel to show up on an x-ray and help us see if there are abnormalities or areas of inflammation in the small intestine and where these areas are. Moving forward, it is important to realize that Crohn disease does not have a quick fix. There's no cure for Crohn disease. However, there are medications that can decrease the inflammation and the pain, which we can discuss. One thing to be sure that you can do is to have a high-calorie, high-protein diet to help your body get the nutrients it needs. Also, you can avoid high-fiber foods to decrease the intestinal workload. And finally, you can also stop smoking to decrease your risk for future exacerbation of your symptoms. And we can help you with this. Also, as you get older, we will do routine screenings to make sure you're not developing any cancerous areas. Do you have any questions for me as your healthcare provider?